Welcome to another episode of Colonverse. I'm Hamna.
And I'm Dhruv.
And we're your hosts for the night. We're here to illuminate your day with some interesting facts. Today's topic is Crohn's disease, which is surprisingly more common than one would imagine.
So you might be wondering that what exactly is Crohn's disease? Crohn's disease is a type of inflammatory bowel disease that affects any segment of the gastrointestinal tract in males and females equally, thereby reducing the life expectancy of an individual. Statistically speaking, Crohn's disease affects nearly 3.2 people per 1,000 in Europe and the Americas, being infrequent in other developing nations. So, without further ado, from our many panelists today, first we have Dr. Coombs from McMaster University, whose lab aims to uncover the reasons behind the increased incidence of Crohn's disease in developed countries.
Thanks for having me. So far, we know that adherent invasive E. coli are the main causes of this disease, but no pathogenic mechanism has been established. We thought antibiotics, paradoxically, may increase risk because they're the main drug pipeline in developed countries. We then conducted a few mass experiments here in our lab at McMaster University, administering certain antibiotics and infecting them with invasive E. coli to induce the disease. Upon analysis, we saw that antibiotics pre-infection upregulate certain gut metabolites. These invasive E. coli can then use these to thrive and outcompete other gut bacteria, which is a pretty crafty adaptation. But they also have other tricks up their sleeves. And my colleague, Dr. Hannah Meissen, is here to outline her studies with these cells.
Thanks for having me, Dhruv and Hamna. As Dr. Coombs said, adherent invasive E. coli are a type of bacteria that strongly adheres to the epithelial or inner lining of the intestines and can invade these epithelial cells. They can also invade and grow within macrophages, which are a type of white blood cell. This activates these macrophages and causes them to release molecules that trigger inflammation like tumor necrosis factor alpha, leading to one of the major symptoms of Crohn's disease, intestinal inflammation. Despite these bacteria being a known factor in Crohn's disease, we haven't found any specific genes or molecular markers that distinguishes them from healthy gut E. coli, making it difficult to monitor and detect them in patients. As we continue to research these bacteria, we will better be able to understand how they influence Crohn's disease and possibly mitigate them as a risk factor.
Thank you, Dr. Coombs and Hannah Meissen, for coming to our show today. We'll now introduce Dr. Sehgal, a gastroenterologist, for a short interview.
Thank you for joining us today, Dr. Sehgal. My question to you is, how do Crohn's disease symptoms differ in patients from varying age demographics?
So the disease occurring in children will mostly have some extra-intestinal manifestation and the symptoms are subtle. So we have to look for that because it will cause a delayed diagnosis. In other scenario, if we look at the older patients, it is more like diagnostic problem in older and young. And it leads to what we can say the prognosis factor. So if the disease occurs in older patients, it will have more morbidity and mortality in a hospitalized patient, and they tend to have more colonic disease.
Thank you, Dr. Sehgal, for the great insight on Crohn's disease. I would now like to introduce another able gastroenterologist, Dr. G.I. Joe, a colleague of Dr. Sehgal's, who Dr. Sehgal consults for a second opinion on diagnosis and subsequent prognosis for patients with severe gastrointestinal symptoms.
Thank you very much for your kind introduction. I'd love to shift our focus to discussing a patient with whom Dr. Sehgal and I have been treating for quite a few years. Barbara came to us with several symptoms indicating Crohn's disease. We learned that Barbara has a family history of Crohn's disease, which is one of many risk factors, and he is younger than 30, which is when you're most likely to develop the condition. We diagnosed him with Crohn's disease about 3 years ago now. And now we are most concerned about complications from his condition, specifically the development of ulcers, malnutrition, or even colon cancer. As his gastroenterologists, we are deeply dedicated to both Barbara's physical and mental well-being. Barbara has kindly volunteered to share his experiences with us today.
A couple of years ago, I started experiencing weight loss and fatigue after losing my appetite. I thought this was due to stress, however, I began having constipation and abdominal cramps. I finally got persistent diarrhea and rectal bleeding, so I decided to go to the hospital. I did a stool test, a blood test, and eventually a colonoscopy, and I found that I had Crohn's disease. Now I have to constantly take antibiotics, corticosteroids, and other drugs, as well as dietary supplements, and each infusion with Remicade costs around $3,000. Whenever I relapses, I begin to eat a low-fiber, low-fat, and low-salt diet until it gets better. I was told that if my condition gets worse, I'll have to get surgery and to remove a part of my colon. I'm also scared whenever a toilet isn't nearby. I hope that my new therapist can help me cope with these daily challenges. I could only think of one thing to say. Dear Crohn's disease, I hate your guts.
Well, I must say, you should keep your chin up and toilet paper handy. Moving on, I would like to introduce our final guest for the night, Miss Looney Tooney. She has been with Janssen since 2015 and is currently the marketing manager for inflammatory bowel disease medication, and we are honored to have her here.
Welcome, Ms. Tooney. Let's begin. We know that Janssen sells Remicade and Stelara for Crohn's disease, but what are the challenges while commercializing these drugs? Firstly, thank you for having me on your show. For any drug coming to market, we naturally have to beat our competitors. For this, we have our patents. Remicade's patent recently expired in 2018. However, for Stelara, we have the patent until 2023 in the US. Since we spend a lot of time and money researching these therapeutics, we need to price them at a sweet spot where they're affordable, but where they also pay off for the years of research that went into making these drugs come to market. Since we're talking money, what is the revenue from these drugs? From the 2019 report, Remicade and Stelara together made 10.74 billion USD in sales. Clearly, you can tell Crohn's disease medication make up the majority of our revenue. This is quite the insider information we were missing. Thank you, Ms. Tooney, once again for coming to our show. Moving on, folks, we'll be speaking with Dr. Coombs again regarding the future research of Crohn's disease.
So, with everything that's discussed so far, I'm optimistic to say that the future of this field is heading towards more targeted therapies. These will aim to address the root causes of this condition rather than treating the symptoms. Right now, we're sort of in a position where we can't stop disease progression, kind of like putting your hand over a leaky faucet to stop the water flow. Hopefully, we can get to the stage where we resolve that leak and put a stop to Crohn's disease right in its tracks.
Thank you again, Dr. Coombs, and thank you to our viewers for joining us for another episode of the Colonverse. I hope you guys enjoyed and learned. Please join us again next week, same time, same place. Stay illuminated.